thank you all again. We are ready to go now. And so we are going to bring up Dr. Beth Collins and Dr. Brooke Salzman. So please give them a warm welcome.
All right. So we're going to be talking about dementia today. So we have some slides ready for you, but certainly we want this to be as interactive as possible. So if you have questions, don't be afraid to stop us. Let us know. Before we get started, what are some ideas that folks have about what dementia is? Yeah.
It's irreversible.
Yep. Can't remember. He said it was irreversible.
It's similar to Alzheimer's?
Similar to Alzheimer's. We're going to talk a little bit about what makes those two things different.
It's one step away from Alzheimer's. Dementia is one step away.
So we'll talk a little bit about the difference between those two things, because that's a common thing people get confused.
It happens when you get older.
Yep, it does happen when you get older. Can happen when you're younger, but hopefully not.
But not always.
Yeah.
Any exercises you can do to prevent the onset of it?
So we'll talk a little bit about that, about kind of what you can do to help prevent the onset of Alzheimer's. So we're going to talk a little bit. We'll tell you kind of what we have, and again, feel free to stop us at any point. Do you mind if I hold the?
No, please.
All right. So dementia, when we're talking about dementia, that's an umbrella term. It's not a disease in itself. It's something that refers to a decline in your memory and your thinking, and it's severe enough to impact your daily life, meaning you can't do something you used to be able to do. So it's not something like, oh, I forgot the keys and then I found them later, okay? It's a little bit more serious than that, considerably more serious than that. It can be caused by many diseases. So saying the word dementia is sort of like saying the word cough. So it's a symptom, it's not really the disease itself, okay? All right, so what causes dementia? Well, the number one thing somebody mentioned before is Alzheimer's disease. And that's something that causes up to 80% of dementia. Also, stroke, which we talked about back in April, can cause dementia. Sometimes when you have a series of strokes, you can get something called vascular dementia, which just means that parts of your brain are cut off from the oxygen because of the strokes that you've had, and because of that, you have problems with thinking. There are many other kinds and reasons for dementia. One of them is HIV disease, and we're going to talk about that in particular. But other things like Parkinson's disease, if you know anybody with that, like Michael J. Fox has that, and we found out Ed Rendell, just had it. Right, and as that gets progressively worse, we see symptoms of dementia in that. So what is Alzheimer's disease? So again, it's the most common cause of dementia by far, and it causes problems with memory, with thinking, and with behavior. We don't know exactly why it happens. We have a lot of ideas. We have some idea about kind of what may make it happen, but part of the reason we don't have any good treatment for Alzheimer's disease is because we don't really know what's going on to cause it. The good news is that there is tons of research going into this area, especially as the US population continues to get older. There's more of a need for it. So hopefully, in our lifetimes, we will find a cure for it. So how common is it? Very common. So how many of you know someone or who has Alzheimer's disease? I'll put my hand up too. Almost everybody. And as you know, Alzheimer's disease affects the patient, but also affects the family because you have to do a lot of reorganizing and shifting in your life to kind of care for that person. So about 1 in 8 people over the age of 65 have Alzheimer's. And by the time you get to 85, it turns out to be more like half of people over 85 have Alzheimer's disease. So incredibly common. This is a graph that essentially shows how many people have Alzheimer's disease, starting with 2010, and then it goes in 10-year increments all the way up to 2050. The different colors are, the lowest color here is for people who are aged 65 to 75, so that's staying pretty even. And same with 75 to 84, staying pretty even. But it's growing because people are living past 85, thank goodness. But as they live past 85, again, their risk for Alzheimer's goes up. Yeah. Yeah, okay. And then when we talk about Alzheimer's disease, we talk about it in stages. So it starts off as mild, then goes into moderate, and then severe stages, okay? How fast, how quickly people, have, how decline is kind of up to each individual patient. And there's not a great way we can say this patient is going to progress more quickly or this person's going to progress much more slowly. Some people live as long as 20 years with Alzheimer's disease. It is a terminal illness. It's something you die from. Often people die with Alzheimer's disease of something else, but it is something you can die of. And generally, we talk about the time frame of 5 to 6 years, or 4 to 8 years, I guess, after getting that initial diagnosis. Yeah.
Is Alzheimer's hereditary?
Great question. So it is, and I don't know if Brooke, you want to talk about
Sure.
that a little bit more.
We make it so there's a early onset form and a late onset. And most typically when we think of as people get older is the late onset when people develop the symptoms of dementia after the age of 65. But there are rare cases of Alzheimer's disease that happen before you're 65. And that early type is thought to be strongly hereditary. There are certain genes that increase your risk for having that early onset. But that's the rare type. The kind of the typical Alzheimer's disease that we see is mostly as we get older. And there's no clear one gene that's causing what we call late onset Alzheimer's. There are some genes that may increase one's risk, and we see in families that if there's someone who has Alzheimer's, there's a slightly increased risk that family members will have it as well, but it's not as clear as the early onset. So if a lot of people in the family have it, it is more likely, but it's not at all guaranteed.
Are they in the age of, people in the age of like 56 or 57, can they get it?
So there is this rare type of Alzheimer's called early onset, so that is a type, but that's the rare kind. Most people that we see and we know of that are the people who get it after the age of 65.
Yeah.
Are they working on genetic testing?
Are they working on? They are working on genetic testing in terms of, right now, even if they identify genes, they're not necessarily able to change the course. It's not recommended that we routinely get tested for these genes right now, particularly for the late onset. For people who have family members who've had Alzheimer's disease young in life, where it may be hereditary, sometimes they will do genetic testing for that. I'm sorry, sir.
Is it because the age level is much greater now than, say, a few hundred, 1,000 years ago, that we're seeing more of it? Or is there an environmental issue to it?
So that's what I think we're trying to work out. We think most of it is from people living longer.
And it's not that there's something in the environment that's causing more.
Not that we've found yet, but that's certainly not something we're excluding.
Right, because we've seen the rates of Alzheimer's disease go up as we've seen other common causes of death go down. So people live longer and then they're more likely. Mm-hmm.
I'm asking something, why they got no medicine for that right now?
So part of the reason is we don't know what exactly causes Alzheimer's disease, okay? And because of that, we can't treat it as well as we want to. There are some medicines, but unfortunately, they work at only slowing the progression of the disease, not stopping it.
Like I went to see my aunt the other day.
Uh-huh.
Right? She gonna say, the dad been here yesterday. He been sitting with me all day. My dad been dead over 6 years. I'm like, huh? She
Yeah.
87. And she don't know there was a brother-in-law sitting with her.
Right, right. And that's something we see commonly with people with dementia of any kind, but especially Alzheimer's, yeah.
And there have been thousands upon thousands of trials trying to look for a cure. So it's certainly something that people have looked far and wide, and animals and humans, you know, to try to find something that's going to make a difference.
The Alzheimer's rate vary regionally around the world?
So it does as people live older, or as people, you know, have better physical health and are able to live longer. So countries that are more developed tend to have longer lifespans, and because of that are more likely to have Alzheimer's. But it's something we're seeing worldwide, really. Yeah.
Is correlated to the stroke belt? You know, talk about the stroke belt. The states that have a lot of strokes and things is also
Yeah.
Alzheimer's.
Yeah,
I mean, certainly, as Dr. Collins mentioned, that stroke can cause its own type of vascular dementia, but the rates of Alzheimer's disease isn't necessarily higher in the stroke belt. But certainly, dementia from stroke may be higher in that region.
Before my aunt died, we used to go see her, and she used to say, your mom been here. It's like my mom been dead over 9 years. And then she used to shake all the time, right? And then she used to smoke a cigarette. Then she used to say, my brother's been here, they been dead years. And she just died about 2 years ago.
okay.
Yeah, so I think we're going to get into some of these things, but people who have dementia, it's very common to either have visual hallucinations, either to see something that other people don't see, or just to have it kind of time and space can get very mixed up. So you can have a memory that's from 20 years ago and it feels like today. So it's very hard to know to that person what happened yesterday, what's happening right now.
Because my father used to say, like, he used to say, well, we used to sleep right there on the couch and stuff, me and my brother. And they never lived there, never lived in the house. That's the thing, like, we live right there, we sleep. We used to stay, my son said we sleep right on the couch. Me and my brother sleep on the couch. And like, they never lived up there.
Right. Yeah.
It can be.
Let's take one more question.
Correlation
Sure.
between falling and getting Alzheimer's, like an injury to the head. I heard that there's some correlation there, but it's not conclusive.
Absolutely. For a variety of reasons, we know that as our thinking changes, we may have a poor judgment or just the ability to kind of perceive everything around us. And so that there, in a variety of ways, having dementia can put us at increased risk for falling.
Oh, no, I meant that the falling, the injury to the head triggers or causes Alzheimer's.
That too, we do know that significant head trauma can lead to Alzheimer's down the road. So we hear that most commonly now with football, right, and concussions and boxing and significant repetitive head trauma. I think we were going to take the one more question and then we'll keep going.
You said earlier that they were going to touch with human animals. Is Alzheimer's or dementia, is that exclusive for human beings?
No, it's been shown in animals as well. And so that's why they've tried to do animal studies to see, what medicines can help improve it.
Okay. Hang on to those questions. I'm just going to kind of start moving on in the interest of time, but we'll definitely get back to your questions, okay? So again, we talked a little bit about this. Alzheimer's is unfortunately a fatal disease and the 5th leading cause of death in the United States. And again, as Brooke said, as other causes of mortality and of death in the U.S. have gone down, Alzheimer's disease has gone up. Yeah, sure. So we have a short little video that we're going to have people watch to talk a little bit about what the difference between Alzheimer's and dementia is.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease, it can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease, it's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia. Which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish. Because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
Okay, so let's talk a little bit about what puts you at risk for Alzheimer's. So first of all, there are things you can change and things you can't change, right? Like anything else. Things you can't change, again, we talked about a little bit, like age. Age is the #1 risk factor for Alzheimer's disease. And the second is genetics, family history. And again, that applies more to the early onset type of dementia than the late onset, but also that. Things you can change that we see some association, and again, not causation, but association between these and dementia are low education levels, low physical activity is a big one, smoking, depression, high blood pressure, diabetes, obesity, and poor sleep. Okay, so a lot of the things that sort of contribute to your overall health. Okay. So again, and age is definitely the #1 risk factor again. And as you can see, this chart kind of shows the rate of Alzheimer's from people who are 65 to 69 all the way up to 90. Okay. So what are some of the signs and symptoms of Alzheimer's disease? So there are 10 that we're going to talk about quickly, okay? The #1 thing that we notice in Alzheimer's disease more than any other kind of dementia is that memory loss tends to interrupt with your daily life and your functioning. So forgetting things you recently learned, forgetting important dates, asking for the same information over and over. And if some of you have been with people who have Alzheimer's disease, this is going to sound familiar. And increasingly need to rely on things like date books and or family to kind of remind them of things. Challenges in planning or solving problems, so having trouble following complex instructions or working with numbers. Trouble following recipes, so if you used to be somebody who could just whip something together and then you find somebody having more of a hard time with that, that's could be a sign. Another thing we ask about when a patient comes in is, have you missed any bills? If so, did you remember to pay them or did they go unpaid? Bless you. Difficulty doing things that they used to be pretty good at doing. So things like driving, which is one of the harder parts for a primary care doctor. When they have older adults who are driving, is deciding when it's time to talk about not driving anymore. Using the phone. I had a woman today actually who I saw whose daughter said she forgets to hang up the phone now. So when I talk to my mom, it just goes on, and sometimes we have to get the neighbor to come over and help her hang up her phone. Doing things like cooking is another thing. If you used to know how to cook and you don't anymore. Confusing time and place, and again, kind of as Brooke was talking about, losing track of dates and seasons, thinking that something that happened 30 years ago is happening today. It's really common. Finding oneself kind of lost in a familiar place and not knowing where you are or kind of how you got there. And then kind of as things go on, understanding visual images and kind of how things are related in space starts to break down. And that's one of the reasons that driving is hard for any of you who are drivers in the audience. It takes a little bit of judgment to see how close or far away things are as you drive. Sometimes even color and contrast can start going away. And you can have difficulty reading. That's kind of one of the ways that falls can come in, because you have a harder time kind of determining where that step is that you're going to step on or where the curb is.
Are these progressions, does the number one thing for getting started first and then
So,
come in, or could the first thing be trouble understanding visual images?
yeah, so often, especially in Alzheimer's disease, memory is the first thing that people notice. But it doesn't necessarily go in this order that we have. These are just 10 general things that could present at any time during the course. Yeah. Problems finding words or speaking or writing, trouble following or joining a conversation, and calling somebody by their wrong name. And please don't worry, we'll talk about what normal aging is if any of you are saying, I do that all the time. So misplacing things and forgetting the ability to kind of retrace your steps, losing that ability, putting things in strange places, and even like accusing others of stealing things because the person lost something and didn't know where it was anymore. Decreased or poor judgment. They can use poor judgment kind of when dealing with money, keep taking care of themselves in terms of hygiene and grooming, maybe wear strange clothing, especially for the kind of weather that's around. Withdrawing, and this is a big thing you see in people who used to like to go out. Now they're content to kind of stay at home and not do much. Kind of removing themselves from things they used to like to do, hobbies, having trouble keeping track of things they used to be good at keeping track of, like sports teams, or remembering how to do a hobby. And then finally, changes in mood and personality. So we see depression happen with Alzheimer's disease all the time. And this is a common thing. And often people who are severely depressed can have signs that look like dementia. People can have mood swings or become very irritable kind of for no reason. And again, people who used to dress with style can suddenly kind of start wearing stained clothes or forgetting to do things like wash their hair. Yeah.
Dress all in black and suddenly I'm wearing hot pink everywhere.
Not that I've seen. Yeah. Yeah.
I mean,
think
maybe
it's-
color. Maybe someone is less particular about what color they're wearing or kind of what style.
Dress like a mummer or something.
Right. I haven't
That's
seen
another.
that
That's another lecture.
Right.
Like mummers and dementia.
Yeah.
Yeah.
I have a question about the Alzheimer's.
Uh-huh.
We discussed that it eventually kills you. What exactly does it do to you that actually ends?
That's a great question. Yeah, and I think that's a thing that even doctors have a hard time kind of wrapping their brain around. So as Alzheimer's progresses, eventually people kind of move from being up and walking around to then sitting more, maybe being in a wheelchair, and then eventually becoming bedbound. And as you become bedbound, sometimes you don't want to eat, you don't want to drink. That's something that could kill you potentially, and it's difficult to get someone to. And the other thing would be, if you stay in bed all the time, you're at higher risk for things like blood clots, pneumonia, infections. Okay.
And just to add in that, what we understand about at least Alzheimer's disease is that there's abnormal proteins in the brain, and basically it causes the nerve cells in the brain to die. So there's a lot we don't know, but we do know that a lot of nerve cells in the brain die that really control a lot of, our ability for memories, to make memories, keep memories, for language, everything that controls our body. So that's essentially also what causes it.
And eventually even brain cells that are used for things like swallowing or things that you need to kind of keep yourself alive are damaged too. Yeah.
Earlier you were saying you were going to be talking about HIV and dementia, because I think that some of my friends who even died, they went through dementia, and they weren't nowhere near 65. So.
Right. Yeah, we're definitely going to be talking about that a little bit later, for sure. So I'm sure all of you, as I went through that list, could think of a time when you had that symptom yourself, or you're thinking, oh my God, I forget. Yeah, yep. Forgetting people's names, forgetting the right word to use. So I want to reassure you that all of that is totally normal, and we're going to talk a little bit about what makes it a sign of dementia. So things that are normal are making a decision once in a while, a bad decision once in a while, missing a monthly payment, but then remembering it, forgetting what day it is, and then remembering later what day it was. Sometimes forgetting what word to use, and losing things from time to time, as opposed to misplacing things and forgetting how to trace your steps back to get them. Yeah.
I go with my kids sometimes, and they're like, well, come here.
Yeah. Oh, yeah. And that's common. And, the thing that we talk about is the aha factor. So really remembering eventually what's going on. That is not something that people with dementia do. So if you forgot to pay last month's cable bill, but you remembered and thought, oh my God, the cable bill, and then you pay it, that's not as concerning. Right?
Or you walk in the room and you say, what did I come in here for? And you're like, and then it comes to you eventually. So as long as it's still coming to you,
Yeah.
There's one question, yeah.
My mom had dementia, Alzheimer's, and some days she would remember names and other days she wouldn't. So it comes and goes with Alzheimer's too, right?
Yes.
It isn't like from then on she'll pick your name.
Absolutely.
So again, it makes it harder to tell between normal aging and dementia because of that.
Yeah.
She had good days and bad days.
Right.
Exactly. That's exactly how I would put it, is that we all have good days and bad days, and when we have dementia, which is already making it really hard to remember and think as well as we used to. You know, we may have a good day where we're able to hold, you know, to perform a little better, but we're going to have, you know, bad days too where we might do worse. So.
There's another condition, item related to this, maybe a subset, but this condition where you cannot remember the name of something. For example, I know a person who works on the sun, who knows it's a source of light and heat. It sees the sky, but can't just know the name. You can't call it the sun. Is that his memory? Is that related to this?
Yeah, so that can be a part of dementia, kind of as dementia progresses, you can see that. But oftentimes that happens kind of in isolation without anything else going on. That's often from things like stroke and other kind of brain diseases. Yeah. Okay, we'll take 2 more questions and then we'll move on. Go ahead.
Oh, I'm sorry.
That's okay.
No. I'm gonna come right out and say, I know we've all heard the term wet brain. Okay, too much drugs, too much alcohol, that can affect your memory. Is that possible to create or to speed up the process of dementia or Alzheimer's?
Yeah, for sure. I think that you're asking great questions. But yeah, we know that people who have been heavy drinkers their whole life often have signs of dementia as they get older and even when they're younger. And we know that kind of the more, we call them insults to your brain, kind of the more at risk you are for things like dementia and Alzheimer's disease. So yeah, that definitely plays into it. Yeah.
I used to my medication. Sometimes I forget to take my medication, right? And my caretaker nurse, he sits them out. But it's this one pill I still forget to take, and it's my sleeping pill. That's the main, no, my blood pressure pill. That's the main pill.
Right.
And last night, I don't know if I remembered to take it, but I took another one just in case. He came in the room, he was like, did you do this? Did you do, but why this and that? Oh. So I have a problem with a lot of stuff.
Yeah.
You know, and as far as going to the doctors, he on top of that too. Cause I'll be like, well, dang, I forgot to go to my appointment.
Yeah.
And what he do, he writes all the doctors' names on the calendar. Good. That's how I remember. Like I remember that I had to go get my eye done, my surgery. And I went, it was on the 28th of last month, I went and I got this retina done. And it's doing good. And he makes sure I put the drops in there, he makes sure I do this. I understand.
Yeah. So if you're seeing stuff like that, then we'll talk a little bit about kind of more things you can do. So what can you do to kind of reduce your risk of dementia? This is something I'm sure most of you are interested in. So there's this, I don't know if you want to talk about this.
Yeah, no, there's this interesting book based on a lot of research done that shows that there are blue zones across the world, meaning that there are certain communities that have a much lower rate of dementia than the rest of the world. And so scientists have gone there to say, what is so unique or special about these different communities? And the communities are across the globe in every continent. But there are similarities between these communities that have low rates of dementia. So these are 3 examples of one in Italy and Japan and California. And the things that they have in common are generally a very healthy diet that it's usually has a lot of fruits and vegetables, usually low meat or fat, a lot of kind of healthy oils like olive oil, avocado, those things. In addition, there's often a lot of exercise in those cultures where people are very physically active and low stress. So a lot of people who they either meditate or are physically active or have ways to help reduce stress in their lives. So it's interesting to think about, again, these common things in cultures across the globe that have low rates of dementia.
My aunt caught fava beans,
yes,
which reportedly called the trigger regional dopa. Is that connected?
I think it's just the beans in general, like kind of a high bean diet versus kind of meats and things like that in terms of protein. So kind of a plant-based diet.
Fava has become the rage.
Right.
Yeah.
I think there's a lot of antioxidants and.
Yeah, I know. I wish that
Right.
could make it into like the middle part that they all.
I can understand Italy and Japan because you guys see them as rural and kind of rustic and
Right.
old fashioned, but Loma Linda, California.
I know, right? I know.
And these are definitely, it's not the whole country by any means. It's
No.
just like these small community within these areas.
Yeah, it's kind of, I think Loma Linda is like near the coast and they just kind of have a tight-knit
My name is
community.
Linda, so I should belong there.
Oh, yeah, okay.
Yeah. I'm looking at this one right here. It say Empower Women.
Yeah.
The Sunshine.
I like
Regardless.
that.
It's Empower Women's. We got this women's retreat that we go on every year.
Uh-huh.
And it's just a bunch of women, so we're going to talk about the Empower Women and where we at.
There you
You know
go.
what I mean? And then you talk about the exercise. I think I lost like 17 pounds. I
Wow.
was 246 pounds.
Wow, good for you. Hi. Go ahead.
I also noticed that it looked like each three of those locations are dry towns. But they have no alcohol or smoking allowed. Now, is that like
A lot of
just
them.
a cultural thing or is it like the law?
So in Sardinia, they certainly drink a lot of wine. Not a lot, but they have a glass of wine with dinner, maybe. Yeah, but you're right, and most of them do not smoke. Yeah.
Yeah, definitely no.
Yeah, that's true.
But not in this community. Definitely no smoking is a commonality.
Yeah, but yeah.
Heshy, who is no longer here with us, told me about turmeric
Yeah.
being an anti-inflammatory.
Uh-huh. Yeah, and we're kind of,
Important for people with, say, HIV.
yeah, yep. So I think we're learning more and more about turmeric. Kind of what I understand now, and I don't know if Brooke, so you can.
Yeah.
And there's a kind of from what I understand, the amount of turmeric you need is pretty substantial to have any benefit, but it's a delicious spice, so why not put it in your food too? So yeah, I think, people are, you can take it as a vitamin. Yeah, but it's not something we as doctors are getting 100% behind yet, just because we're not seeing very clear data that helps. So that really shows no help. Every couple of years, there's a new kind of in-trend sort of thing that can do a lot of things. Resveratrol from wine was like that a few years ago. Now turmeric is sort of in. So generally, I tell patients, eat mostly plants and try to cut back on meats and saturated fats. Okay. And exercise is the single best thing you can do to keep yourself healthy as you get older. And that's not just for dementia, but for many other things. And kind of when we look at things that have prevented dementia, nothing has really panned out except for exercise. So there's decent, signs that eating a healthy diet and not smoking can lower your risk of dementia, but nothing quite helps as much as exercise. And then, of course, taking care of yourself. It's good just in general, right? Getting regular checkups, taking your medicines, eating healthy food, getting enough sleep, limiting alcohol, don't smoke or quit smoking, and reducing stress. So if you're having trouble remembering, things you can do or use things like memory aids, so calendars, date books, labels. Pill boxes are a big thing we try to get patients to use. It can really help because I think, just about everybody can forget whether or not they took a pill. So, and then making sure that if you're caring for someone with dementia, that there are things that can help keep them safe, like automatic shut-off appliances, like safety locks on the doors. Looking at how they drive and consider maybe having them get around by a different means. And then also like the Lifelines, the I've fallen and I can't get up commercial, like that Lifeline can be helpful. And again, get help and support. If you're caring for someone with dementia, some of your best resources are friends, family. They want to help, this is the time to kind of use them and reach out for help. There are also a couple of community organizations that I'd encourage you to take a look at. One of them, the biggest, is Philadelphia Corporation for Aging. Another is the Alzheimer's Association. They have a 24-hour hotline that people can call in when they're having trouble with a patient, with a family member or a loved one with dementia. So let's talk a little bit more about what caregivers do. So caregiving can be tough. Has anyone had to care for someone with dementia? Yeah. What have been some of your experiences with that? Go ahead. A lot of patience. You're absolutely right. Mm-hmm. Sometimes you have to stimulate the conversation. Yeah, go ahead.
They have, like some of them, like my aunt, she was like this, you could never get out of her sight.
Yeah.
I mean, she would always call you. You couldn't even go to drink of water. Where you at, you know?
Yeah.
Like that, and it's just that it wears you out.
Yeah,
like
right.
You come back and forth, and then nobody else want to help you, you know?
Right,
Nobody
right.
help you.
So, and I, right.
Bring
And
the
I
kids
think,
in. It's a hit upgrade on, you know?
right, right. And I think that's like when you know, asking for help from other people. That may include like community organizations like Philadelphia Corporation for Aging that can help bring in aides if you qualify for them, or things like that, or other family members. And taking care of yourself as the caregiver. Think of the putting your own oxygen mask on first, I think. Some of the things you all were talking about is exactly what we advise caregivers to do. So things like staying calm and patient, trying not to take behaviors personally, thinking about maybe they're in pain and that's why they're acting out. Trying not to argue or convince somebody that it's, you know, that no matter how much you tell them that their brother who passed away 20 years ago has passed away 20 years ago, they still think that he's alive, you know, kind of letting that pass and just say, okay, and then kind of redirecting them towards something else to talk about. So these are some of the resources that I know we have some more resources in the back. And I think we talked about everything. So I briefly want to talk about HIV and dementia, okay? Before I get started with that though, anybody have any ideas about HIV and dementia? What comes to mind? What are some of your experiences with it?
Because I know that HIV breaks the brain barrier and gets into the brain, and it destroys some brain cells.
Yep.
And that's why I asked, is it reversible?
Yeah. So we'll talk a little bit about that. Yeah.
I'll be in HIV. You take a lot of meds.
Yep.
You know, and I think you have a lot of side effects from a lot of medicines.
Mm-hmm.
I believe that this possibly be a part of it.
Yeah, yeah, and I think people are really concerned about that, especially some of the older meds. They were not quite as well tolerated as some of the ones today, or if you need to be on more complex regimens, they can definitely have bad side effects. So yeah, for sure. Mm-hmm. Absolutely, I totally agree. Yeah.
Piggybacking on that, some that's cross the brain and blood barrier and others don't.
You're absolutely right.
Radiation
Yeah.
does. So
Yeah.
you got to be at least on one of them that crosses the
Yeah.
blood.
Right, right. Yep. And so HIV dementia is only one part of kind of a larger disease called HIV-associated neurocognitive disorder, or HAND. I don't know if anyone's heard of this. And there are kind of 3 levels of severity of HAND, and the worst being HIV-associated dementia, kind of and the upper 2 being kind of more mild forms of kind of brain fog. It used to be known as something like HIV encephalopathy or AIDS dementia complex. And as opposed to a lot of things when we talk about HIV, it's caused by the virus itself. It's not caused by something else that invades an opportunistic infection or something that comes in and causes the dementia. So it's actually the virus invading or causing damage to the brain cells.
The one that's asymptomatic, how can you protect yourself against it if you don't know it exists?
Yeah. So the one that's asymptomatic, really, you can only tell if your doctor tests you for it. And you know, it's a little bit unclear what you do with it because it's not affecting your life. So I wouldn't worry too much about that. Yeah, the middle one is something that's a little bit more concerning because that's kind of when you start feeling it and seeing it in your daily life. Yeah. Comorbidities? Yep, yeah, and as somebody was saying, you know, the more medicines you're on, the more side effects they have. And, you know, most medicines that we're on, the benefits of being on them tend to outweigh the risks of being on them. But I think if you have questions, certainly ask your doctor. Yeah, but or the pharmacist, absolutely. So, one thing people are asking, or I've heard people ask, is can you have HIV-associated dementia if you're on treatment? Now, I have good news and some bad news. So HIV-associated dementia is much, much, much less common. Some people say up to 10 times less common in people who are on treatment, and especially those who are undetectable. So taking your HIV meds is key to preventing HIV-associated dementia. Some of the other the mild neurocognitive disorder, that is something we see even on people, even with people who are on treatment. So what puts you at higher risk for HIV-associated dementia? Not being on treatment is number one. Having a low CD4 count, getting HIV, becoming positive at an older age, the infection, you know, having had the infection for a longer period of time, and a lot of that, again, is because of older meds having more side effects, and having another AIDS-defining illness.
Can I ask you, why would old age affect?
So they think it's kind of about the brain's vulnerability. So as we get older, kind of any insult to the brain is, exactly. There's less kind of reserve, I guess, in the brain as you get older. Yeah. And then what are some of the symptoms? Kind of the same symptoms we were talking about with dementia in general. And again, these things have to impact your daily life for it to be called dementia. What about less severe things? So again, kind of the milder types of thinking problems in HIV can even present to those who are undetectable. They're different from dementia because they don't impair your functioning significantly. But some people have estimated that up to a third to half of people who are HIV positive have some level of thinking problem. And does HIV put you at higher risk of Alzheimer's? I think I've heard people ask about. Probably not. But again, there's kind of that evidence that the chronic inflammation of HIV puts you at higher risk of everything that comes along with aging. So what we've often seen is that people who are HIV positive, instead of getting Alzheimer's when they're 80, maybe get it when they're 65 instead. So getting it younger. And it's not clear whether or not taking medication really helps stop that. Yeah?
Earlier you were talking about for Alzheimer's that there were lifestyle changes that could help maybe prevent. Are all those the same for the HIV Alzheimer's?
Absolutely, yeah. And again, I would encourage you, if you're worried about this, to talk to your doctors and kind of ask about kind of, you know, the regimens you're on, making sure, again, that you have a medicine that kind of crosses the blood-brain barrier if that's a concern for you. And, you know, they're the experts that can hopefully help with other things to kind of make it better. And again, you are much more likely, if you're on treatment, to have dementia from something else, something that is not HIV. So your doctor can also test you for other things. Yeah.
When I used to do nurse assistant and I was working, we had a lot of older patients with dementia and Alzheimer's. They was very feisty and want to fight and everything, swing on you. And I was very surprised about that.
Yeah.
Yeah.
Yep, for sure.
And it took 4 of us to give one big guy a bath because he didn't want to take a bath. And it took 4 of us to give him, put him in the tub and run the water and then bathe him, then take him out, wipe him off and everything, you know.
That's not an easy job,
Yeah.
as you know.
Yeah.
Yeah.
I have a question about these facts in particular.
Uh-huh.
Were these things discovered before, back when like HIV medication was not as advanced as it is now?
So some of the things. So one thing we've seen is that people who have never been treated for HIV, and this is coming mostly from the 80s and 90s, about 20% of them at some point in their life get HIV-associated dementia. Kind of now, again, HIV-associated dementia, I have to say, I have seen maybe 2 or 3 patients with it my whole career. So it's definitely much less common. But kind of the thing that people are more concerned about is this kind of lower level of problems with thinking and memory. And some people say that that's from the period of time from when you become positive to when you start treatment. So that's kind of one of the reasons that there's a big movement now to start treatment early, because we think that some of the damage that occurs when you first get infected may cause some of that brain damage. Some people think it may be from medicines, although that's not clear, again. And some people think that there is HIV in places in the body that we can't get to with any medication, and that's what's causing the damage. Yeah.
On your paper, it said low education and all that.
Mm-hmm.
Except for low education and one other thing, I had everything on there.
Yeah.
Should I see my doctor for that?
Yeah, I think.
I mean, for dementia, is that what you do?
Yeah, so I think if you're worried about your thinking, about your memory, I would encourage you to talk to your doctor about it. Right, yeah, and you know, yeah, and talking about how you can change those things, I think, are important too. Yeah.
Doctor, as typical Joe Blow live off 52nd and Market, 63, go home, I don't have a significant other, I live alone. What type of things should I be doing? Like, it's hard for me to even read a book because I lose concentration, I'm wondering.
Mm-hmm.
I try to do seek and find, I try to do puzzle books to stimulate some type of activity.
Yeah.
Look at pictures, seek and find in this picture, what's not in that picture. Just things to keep myself kind of clicking, because sometimes you feel disconnected.
Right.
Not that you're afraid that it's Alzheimer's or dementia, but like, I'm kind of losing it now. Yeah. And I think it's a part of the staging of the aging process. You go through puberty, adolescence, adulthood, then like at 50, I think now that I'm 60, I'm noticing different body changes.
Sure.
So is that a proactive stay in the table?
I think definitely. The other thing I would really encourage everybody to do is become involved in community organizations like the LGBT Elder Initiative, I think is a great one. I was not a plan, I promise. And doing other things that gets you out in the community, gets you talking to other people. Social interaction is probably one of the more important things that can help prevent dementia.
It's mind-boggling because I've had 2 heart attacks. And just go home, take it easy, and do this. That day I came home, I had to go get food.
Right.
You know, you
Yeah.
hopefully have people in place that can do things for you, but you know, you feel a burden sometimes, you know. Then you gotta wait until they're available. So, and just kind of staying independent and maintaining that independence.
It's a struggle,
And it's
right?
hard sometimes,
Right.
very.
Yeah, yeah.
I drink a lot of coffee. That's the unrelated part. I go to a lot of cafes. There's one out in my neighborhood I go every day. I come to ones in town. All the older people I see are sitting there doing crosswords.
Yeah.
Does this really work?
So there's not a lot of evidence that doing crosswords, doing Sudoku does a lot. But anything that you enjoy that keeps your mind active can help prevent dementia. Yeah. But in particular, crosswords, Sudoku, not necessarily.
And I would just support that if you like crossword puzzles, it's great. That's what you enjoy and keeps your mind active. But if it's not, it doesn't have to be crossword puzzles.
Right.
To find something that just kind of keeps you mentally engaged and interested.
Yeah.
This question might be better addressed to social workers or psychologists, but I'm going to ask it. It's really the reason I came in. In my social circle, there is a man who is in his mid to late 60s. And over the course of the last year or more, we started to notice that he would become forgetful. Well, at first it was kind of funny, we joke about it, and it's increasingly getting more severe. To the point that when you're in the passenger seat of his car and you say, now turn right at the next intersection, he goes right through it. And when you say you were supposed to turn, I was. So, but when you start to bring up to him something might be going wrong, he gets incredibly defensive and won't listen. And we're concerned this person lives alone, where he puts a pot on the stove and goes to bed.
Right.
How do we address this?
It can be hard. Certainly at our office is called Jefferson Geriatrics, and we have a program called a geriatric assessment program where people come for, it's a team-based approach where we often will have a social work intern as well as the doctor and the pharmacist, and kind of trying to do a holistic evaluation, often focused on memory, but sometimes we encourage people to come in just to kind of do a full body assessment. So not necessarily target saying we're going to focus only on your memory, but making them feel like we're going to be evaluating a whole, all of them, do a comprehensive eval. So that's sometimes one way is to get someone in is to send them for what's called a geriatric assessment. If you can, sometimes you can get their permission to call their doctor just to let them know about your concerns. So then they can evaluate it further, or be willing to go with them if they're concerned.
They won't go.
And they won't go.
Can I ask a
Certainly
question?
people, What,
They won't go because they're afraid that they have Alzheimer's.
They don't have Alzheimer's. What are you talking about? I'm fine.
But I mean, that's the reason why they won't go.
Yeah.
Because okay, well, I had a friend who was so scared of having Alzheimer's because her father had it, and when she saw him put in constraints, this was years ago. She stopped. She didn't go to the doctors, or eventually she went. It was a brain tumor, which unfortunately was fatal. But she was happy because it wasn't Alzheimer's.
Right.
So, it doesn't, what
That's a great point. Sometimes you can tell someone there might be something very, that we can figure out and treat that can, reverse what's going on.
Like thyroid
I'm
problems.
looking at the fact that you're telling somebody about their independence.
Yeah.
There's nothing wrong with me. I can still drive. I can still go to the market. I can still
We
pay
see
my
that a
bills.
lot.
It takes a lot
Yeah.
to snatch that
Yeah.
and to say, hey, I did make this out for not enough money, or I made it out for too much money.
The Philadelphia Corporation for Aging does run adult protective services. If you were ever really worried about someone, you can call adult protective services. They have a hotline where you could say, I'm worried about them, and that will start an investigation. But it could be kind of gently, patiently trying to nudge them to be evaluated.
Yeah, the PCA helpline number is 765-94.
Yeah, I have,
What is it?
765-94.
Okay, 215.
215.
I'm not sure if you've seen the research that's in Philadelphia, but in Audubon, New Jersey, there's an agency that will help you with your rent, with food shopping, Meals on Wheels.
Exact, same
and
thing.
in-home services, but I don't know Philadelphia.
So every area,
PCA,
every
yeah.
area has a local area
Yeah.
agency on aging. So probably, you know, Montgomery County and Philadelphia County is PCA.
PCA, okay. And there might be good services that people don't know about.
Exactly, there are.
But I think kind of, you know, for your friend in particular, I think, you know, as Brooke was kind of saying, expressing, you know, you've seen these things, you're worried about their overall health and wonder if you could help them in some way get to the doctor. I'm sure. Yeah, sometimes, you know, I hate to do that, but unfortunately, a lot of times when people have the symptoms of dementia, there's not a lot of kind of self-awareness of it. Yeah, and I'm sorry you're going through that. That's a difficult position to be in.
It's a little off. I have a best friend. He's 57, he just retired last year. He has no short-term memory, but he has always not had that since he was a kid. Now, you have to realize this man is quite brilliant mathematically. He worked on computers launching missiles from battleships.
Oh, man.
So it's a little scary to think. But is it possible to have no short-term memory and it's not dementia?
Yeah, and I think people have different levels. There are some people who have.
But he can launch a missile
Yeah.
at North Korea.
Right.
I'm not kidding.
Yeah. Yeah.
That's not dementia, right?
I would say if it's just that and it's not getting worse over time, that I would not be too worried about it. Yeah, yeah. I think so, because there are kind of different parts of your thinking, and memory's just one of them. So he may be a little bit below average in memory, but above average in many other things.
I mean, he's aware of it, and he's told me about it, and I just think, my God, dude, you launched missiles.
Yeah.
Did you remember where you launched it?
Right.
But
Right.
he can't remember where he put his keys when he comes in the door.
Right,
You know,
right.
like,
Yeah. I think, you know, a lot of times too, anxiety and depression can cause symptoms that look like dementia. Most of the time people say things, you know, come in and say, I have no memory, but it's often because they're depressed or they're anxious or they're kind of, you know, focusing on too many things at once. Yeah.
I had leukemia in 12 years, and I lost my short-term memory. After that.
Yeah.
I had it vital before that, but after that.
Yeah,
Ask me what I had for lunch yesterday. I can't remember, but I can remember, like you said, I can remember shooting artillery, having the guys shoot artillery in the military.
Yeah.
I was in charge of them, but after, during and afterwards, it was only after I had the leukemia that my memory, short-term memory. So it could be other causes of it.
For sure.
Medical.
Okay, so I think maybe we have time for one more question, then we're going to wrap it up. Anything else? Okay. Well, thank you all so much for coming.